I'm Dr. Stephen Goldstein. I'm a professor of obstetrics and gynecology at the New York University School of Medicine and here at the NYU Langone Medical Center in New York City. And this is another segment in our series, Reducing the Confusion in Gynecology. The topic is things you should know about birth control pills, trying to reduce the myths. Birth control pills, when I was a student, came in 80 and 50 microgram strength. By the time I was a resident, they were 50 and 35. Most of my career, they've been 35, 30, 25, and 20, and now there is a 10 microgram pill. But interestingly enough, the lowest dose pills are too low for young women under 30. See, bone is a hormonally sensitive organ. I often have patients who will bring their 17-year-old daughter in and say, I want to put her on the pill, and I want the lowest dose. And I say, well, okay, why do you want the lowest dose? And they think it's the safest. But there's good science that shows that women under 30 who are on the lowest dose pills get less bone growth at a time when bone is growing geometrically until age 30 or 35 than women who are on the lower dose pills. The lower dose pills are too low than women getting their own cyclic menses. This is really helpful for perimenopausal women. If a woman is in her 40s, especially if she's had any fibroids or heavy menstrual bleeding, being on these lower dose pills is excellent, but not for younger women. What isn't understood is that the pill works by suppressing ovarian function. So I can understand why many women would look at a pill and think, it's got estrogen and progesterone, why would I want to put that in my body? But what isn't explained is that that pill works by turning off ovarian function, so it becomes instead of your hormone, not on top of your hormone. And in these lower doses, it's actually less than what your body can make month after month after month, which is why it's so good for perimenopausal women who are at greater risk for breast cancer, who often have fibroids, who often have heavy bleeding, but too low for young women. Another word when we're talking about pills is natural. What did nature expect? We're higher order primates. Nature thought you would have 8 children. You'd have to nurse them all for 12 to 15 months. There's no bottle or formula in nature. So do the math. Most women have about 40 years of reproductive life, roughly age 11 to 51. 13 lunar months in a calendar year, 40 times 13, that's 520 cycles. Most modern women, maybe they have 2 kids, nurse them for 3 months, they end up with close to 500 cycles. What did nature think? Nature thought you'd have 250 cycles. One of the reasons that ovarian cancer, uterine cancer, even breast cancer are on the rise in modern industrialized nations is women are cycling too much. And so suppressing the ovarian cycle with something like birth control pills is actually closer to natural than simply getting an ovulatory cycle. Burst and repair every month of the ovarian capsule. That's not what nature intended, and that's not a healthy situation to be in. So there's a lot of myths about birth control pills, and hopefully this will help to debunk some of them.